All right, so next up, I'd like to introduce Lindsay, who is working on a project that involves parents and families of children born prematurely to help identify what information is meaningful to them and to help put in place proven interventions that will improve language and thinking ability. So with that, Lindsay, I'm going to hand over the platform to you, and feel free to take it away.
Thank you very much, and welcome everyone. Thank you again to the Child Bright Network for hosting this virtual symposium, and I'm happy to share some of the work of the ParentEPIQ team. And today I'll be discussing our Aim 1 in developing meaningful outcomes for parents of very preterm children. So I've outlined some brief learning objectives of what I hope to cover in the next 10 minutes. I'll start by describing developmental challenges faced by children born very preterm. Then go on to describe a study we did looking at parent perspectives and comparing those with medical definitions. And lastly, I'll speak about how we're integrating parents' voices into our future research. So to start with some definitions, gestational age is a measure of the duration of pregnancy from the first day of the last menstrual period up until birth. So if an infant is born full term, they have a gestational age of 40 weeks. Although some infants may be born earlier than that, and if they are born at less than 37 weeks of gestational age, we consider them to be preterm. And earlier than that, if they're born at less than 29 weeks, these are infants that are born very preterm. And this is the population of children that we'll be talking about through the rest of this presentation. So if a child is born very preterm, what are the challenges that they're faced with, especially in neonatal period and into the early infancy? There are short-term and long-term problems that can be associated that may affect each organ or system within the child. Our main focus is among the brain and the neurodevelopment of these infants that are born very preterm. So all children that were born very preterm in Canada are seen at neonatal follow-up clinics across Canada at the age of 18 to 21 months old. And at their neonatal follow-up visit, they undergo standardized neurodevelopmental assessments, and this information is collected through the Canadian Neonatal Follow-Up Network, or CNFUN. CNFUN reports on the health and development of these very preterm infants, and this information is very important for healthcare providers and for parents in order to plan for their baby's needs. So CNFUN has used medical definitions in order to describe neurodevelopmental impairment, or NDI. And these are generally based on hearing, vision, cerebral palsy, CP, and developmental status of the child. At the initial assessment, they undergo standardized assessments, and we look at CP severity based on the gross motor function classification system. And we're able to look at neurodevelopmental status, including motor development, cognitive development, and language development through the Bayley scales of infant and toddler developed 3rd edition. So then using this information, CNFUN is able to classify these children as having no neurodevelopmental impairment, or having a mild, moderate neurodevelopmental impairment, or having significant NDI. And we're able to do this using those 5 domains that I mentioned before of motor, cognitive, language, hearing, and vision. And these are all based on the scores from those standardized tests. So this is classically how we've been defining NDI, but there's no consensus on how to measure, define, or really report neurodevelopmental impairment. And in fact, we're missing an important key player in the lives of these children, and that being parents. In fact, parents have never been asked which outcomes they perceive to be most important. And this brings me to our second objective, speaking about parent perspectives and comparing those to the medical definitions. I'd like to introduce ParentEPIQ, which is funded through the Child Bright Network. And in our Aim 1, we aim to engage parents to co-create definitions of neurodevelopmental impairment. This is the first of a 4-step approach where parents will identify meaningful outcomes and co-create definitions of NDI. So as I mentioned, in the 4 steps, we start with step 1, and this is what the focus of the presentation is today. So in step 1, we have examined agreement between parental and CNFUN classification. So our overarching question is, how do parents' perspectives of their child's development compare with the current CN-FUN medical classifications of impairment? So in order to answer this question, we had CN-FUN parents at 9 sites when they came into their 18 to 21-month visit answered this question. And the question was, please tell us how you would rate your child's development. And they can rate their child's development as developing normally, having a mild or moderate developmental impairment, or having a severe or significant developmental impairment. These responses were then compared to the child's CN-FUN developmental assessment using the current NDI definitions, and then using Cohen's kappa statistic, which I'll mention on the next slide. So in terms of our population, we had a population of children who were born at 26 weeks of gestational age, and they were born at a birth weight of 904 grams. These children were about 19 months old at the age of their clinic visit. And looking into the agreement between the parent classification and our classic CN-FUN definitions, we use Cohen's kappa statistic. And this statistic varies from 0 to 1, with 1 being a perfect agreement and 0 being an agreement equivalent to chance, with increments in between from slight, fair, moderate, substantial, and near perfect. So when we looked and compared the two agreements, we saw that the agreement was fair, with a Cohen's kappa of 0.22 that was statistically significant, but as you can see, this is tending towards the lower end of the scale. Then we want to look at the agreement of parental classification versus CN-FUN NDI classification. So we had a study of 237 parents who completed the question that I presented earlier. And using the CN-FUN definition, we found that these children were categorized, 54% of them were categorized as having no NDI, and 17% had significant NDI. However, in contrast, when we look at how their parents classified their own children, we found that 65% were classified as having no NDI, and only 2% had significant NDI. So as you can see, CN-FUN tends to categorize children as having more impairment than their parents do. For example, of the 109 children with a mild, moderate, or severe NDI, according to the CN-FUN definition, 52, which is about half, were considered to have no NDI as per their parental classification. While there's areas of disagreement, there are a few areas of agreement, including 102 that were categorized as both by the parental group and the CN-FUN classification as having no NDI. And then 5 of these children were classified as having severe NDI by the parental group as well as the CN-FUN group. We then wanted to look at the comparison between the groups that agreed and the ones where there are discrepancies. And we found significant disagreement between CN-FUN and parental categorization for the Bayley cognitive score, language score, and motor score. But if they were categorized by cerebral palsy, there was no significant difference. We also found significant disagreement in terms of hearing impairment, and then the numbers were quite small for visual impairment. So in terms of our conclusions, these preliminary results have shown only a fair correlation between our parents' perspectives and then the healthcare provider outcomes of NDI. In the future, we'll be combining these with other parent feedback to develop more meaningful outcomes. This is really important because we need parents to be involved in co-creating definitions in order to improve the care for very preterm infants and their families and to guide our future research. This takes me to our last learning objective, speaking about how we're integrating parents' voices in our research. So I briefly spoke about step 1, where we found that there's a discrepancy between how parents are describing their children and how we've defined it through CN-FUN. So now in our next step, step 2, we're looking to explore the outcomes that parents of these premature children consider important. And we're doing this through a quantitative survey of their own child in Vancouver, a qualitative study of their own child in Montreal, as well as the survey that all taken place in Vancouver. In our next 3, we'll be creating a working group to review these results, and we're going to revise the CN-FUN outcomes and definitions. And then lastly, but most importantly, we're going to have See and Fund parents validate these results to ensure they are the most meaningful to them. So before I leave you today, if there's anything I'd like you to take away for this, the one key take-home message will be that parents' voices are important to be included in research. And I hope I've shown today that especially need to be included in clinical outcomes of prematurity. With that being said, thank you very much to all the parents involved in See and Fun, as well as the ParentEPIQ team for having me engaged in this project. And thank you again to Right Network for hosting this virtual symposium. Thank you very much, and I hope you to ask, I'd be happy to answer any of your questions. Thank you.
Well, thank you, Lindsay. Sorry, we just had a bit of a glitch there, but the questions are coming up now. Yeah, thank you for walking us through it. That was a great presentation of the work that you all are doing. So one question that we have popped up is displayed on the screen right now, and essentially it's asking or stating that the disparity between parental views of disability and an objective tool is quite striking. What is the plan to address this disparity, or I guess how is your working with parents to redefine those going to help with aligning the disparity a bit?
Well, that's a great question. Thank you very much. I think it is quite striking what we found between the parental views and then the objective tool that we've been using in the past. And I think this also draws more attention to really the importance of having those parent perspectives at the get-go. So we're moving forward with trying to find which outcomes. We know that there is a discrepancy, but we don't really know in which categories and in which domains of neurodevelopmental impairment there is a discrepancy. So we're looking to see with the parents through the next step of the project, through those 3 studies that I briefly mentioned, to define which are those outcomes that are most important, and then we'll be able to revise the definitions and move forward in that way.
Oh, wonderful, thank you. There's one question I have that's perhaps a request that's not really a topic of your investigation, but I was wondering if there's a difference in the views of mothers and fathers when it comes to these NDI definitions, or aligning their viewpoint with the current definitions that you are using.
Yeah, that's an interesting question. We don't have specific mother-father data on this, but we did look at parent demographics in terms of those who were a single caregivers. We looked at ethnic group, employment, and education, and we didn't find any discrepancies between parents' demographics, but it would be interesting to look more mother versus father or other caregivers and to see how their views are different and how they value different